Hello everyone, welcome back to the channel. So today is a review on some terminologies used in nursing, particularly medical terminologies used in nursing for student nurses, nursing associates, and healthcare assistants. These are OSCE inspired questions and answers, and the questions has come from previous question banks from student nurses and nursing associates, and we've sort of put a bit of this together to have a review on that. So without further ado, should we start? So the first question on our list is saying, which of the following is not part of an anticoagulant therapy? And we've got aspirin, clopidogrel, apixaban, warfarin, and bisoprolol. We will give it a minute so we think about our answer. Should we review our answer? So the answer says E, bisoprolol. So and it's the explanation says anticoagulant therapy is the initial strategy used to prevent and treat thrombosis with the use of medications such as clopidogrel, aspirin, apixaban, and etc. In the above question, bisoprolol is the word odd one out. It is a beta blocker that works on the heart circulation, i.e., blood flow through arteries and veins. Bisoprolol is used to treat hypertension or high blood pressure. Yeah, it's true because um, anticoagulant therapy could be combination of medications such as antiplatelet or anticoagulant, which can come in oral form or injectable or other forms. These are used to increase the amount of time in which blood clots in the veins or arteries. And when we look at these questions, the medication, the clopidogrel, aspirin, and apixaban we've mentioned here is not limited. Anticoagulant therapy that is not limited to only these ones we've mentioned. There are a lot of them, but this is what we've mentioned here in this particular question. And we can see that even though it's saying bisoprolol helps with it works on circulation, it does not fit in the anticoagulant therapy or treatment. So that is the reason why it is the one odd we've taken out. So the answer here is bisoprolol. All of the ones we've mentioned, so if you see a medication, aspirin, apixaban, um um tinzaparin, all of these ones are all anticoagulant therapy. They prevent blood clots for our patients. For example, let's say you've got a service user on the ward and they are not moving as though they would move at home. We will give them things like tinzaparin, heparin, and stuff like that, just to ensure that they are not having blood clots as they would not be moving when they are in hospitals as they would in or wards as they would in when they are at home. So the next question is question 2. It says, which of the following is likely to occur in a patient who has had an unwitnessed fall and sustained a minor injury to the head? And we've got cardiogenic shock, we've got hypovolemic shock, we've got distributive shock, and we've got obstructive shock. Should we give it a minute and we answer? We review answer. the answer says B, hypovolemic shock. And it's giving us an explanation to say hypovolemia is a loss of blood. Hypovolemia is loss of blood, plasma, or extracellular fluid. This can occur when an individual loses too much blood or becomes extremely dehydrated. In the scenario above, the patient might have lost blood following the fall. Yes, so this is true. All the other um, shocks we've mentioned, things like distributive shock could be seen in things like septic shock that can progress. The cardiogenic shock could be with maybe say cardiogenic, so obviously it deals with the heart, and the obstructive one as well. So the distributive could be also things like anaphylactic shock. Also, here is saying hypovolemia, and we know hypovolemia could be loss of blood from if you've taken antidiuretics, things like furosemide, and you're losing too much fluid. You can have hypovolemia if you've fallen and you've lost circulatory blood. That can cause hypovolemia as well as if the individual has lost too much fluid through sweat, or if they become too much dehydrated, that means they have a potential of getting a hypovolemic shock. So in this case, our service user, our lovely person who had a fall, could have hypovolemic shock. So that is right. You can give any explanation at the comment below, in the comment section below, if you want. Our next question says, which of the following is an indication that your patient is tachypnic? Tachypnic. That's interesting. Right, let's see. Think about our question. So here it says, Paul, I'll keep quiet and let you read. Should we review our answer? So the first answer A is pulse rate of 95 beats per minute or more. Pulse rate of 45 beats per minute or less. C, respiratory rate of 25 breaths per minute or above. Respiratory rate between 12 to 20 beats per minute. Respiratory rate of 12 breaths per minute, and low. Okay. Right, let's review. So it's saying the answer is C, respiratory rate of 21 breaths per minute and above. And it's giving the explanation to say tachypnea refers to rapid breathing. Okay. The normal breathing rate for an average adult is 12 to 20 breaths per minute. The number of breaths per minute in a newborn and children in newborns and children is higher than the resting rate in adults. Okay, so let's go back to the question and use that to explain. Sorry, where am I? Here, sorry. So it's saying, so we all know that pulse rate is the measurement of using the radial artery or brachial artery um to just check the heartbeat of this person. and it is the one that we don't use digits to calculate. Okay, so now it's saying pulse. So pulse is different from respiratory rate. We know that respiratory rate is the breathing rate that is looking at the rise and fall of the chest of the individual. That is where we count our respiratory rate. That's the amount of um, breath an individual takes within 1 minute. So we are gonna take the answer A and B out. They are completely out. They don't fall in this answer. Now when we come to the C, it says 21 breaths per minute or above, which is greater than the normal range, which is 12 to 20 breaths per minute. An average individual taking up to 12 to 20 breaths per minute. So that is the normal one. But then when we come to this, the D, that's the E. The E says respiratory rate of 12 beats per minute or breaths per minute and below, which is a bradypnea, which will be below the normal range. So if we looking at it, this the D will be the normal range. So it is normal for this patient. 12 to 20 breaths per minute is normal for this patient. E, 12 and below is low for this person. And C will be the highest because it is gone past the 20 breaths per minute and is saying even more. So obviously the answer is C. But also one thing to bear in mind is that respiratory rate is one of the first indications of deterioration in your patient. So if you see that your service user is having more than 21 breaths per minute, that means the other signs and symptoms, one of them will be indicating that this service user is not doing well and they might need urgent urgent medical care. So the C is the correct answer. And that is the explanation we've mentioned already. Right, let's get to the next question. Question 4 says, which of the following can cause polyuria in your patient? Polyuria in your patient. So we said diabetes insipidus, diabetes mellitus, the use of antidiuretics, pyelonephritis, and all of the above. Give it 1 minute for us to think about our answer. So the answer says all of the above. Okay, let's see the explanation. Polyuria is the production and excretion of more than 2,500 ml of urine per day. This condition can occur in all of the above conditions, but it's not limited to the conditions above. It is important to know polyuria can cause hypovolemia, and this needs escalation to appropriate medical team. Okay. So, yeah. So we know that when you have diabetes, there is issues with polyuria at night, and also same as when you have you are on antidiuretics such as ferrisimide and stuff like that. You tend to, because these medication allow you to offload fluids, you are likely to use the toilet quite often. Pyelonephritis, this can be with infections with the kidneys, and so it could be that you are having maybe an infection here, so you can be going to the toilet quite often. So that could be part. So I think, and same as diabetes insipidus. So the question, all of the above seem to be right, and it's explained this for us. Let's go to question. So what have we done here? I think one of our questions has come up, right? We're gonna have to fix it. So that 9 needs to move. Yeah, sure. That's right. So I think I clicked it. Now question 5 is saying, what is the best name to describe the severe central chest pain due to reduced blood supply to the heart? So, what is the best name to describe a severe central chest pain due to reduced blood supply to the heart? And since it says A, myocarditis, B, hypotension, C, stroke, D, stenosis, and E, angina. So the answer says E, angina. Explanation, it says is angina is the chest pain caused by decreased blood flow to the heart muscle. It it is usually less life-threatening. However, it is a warning indication that the patient is likely to be at risk of heart attack or stroke. The two types of angina are stable and unstable angina. This is the most serious form. So, unstable angina is the most serious form. The causes of angina may include smoking, increasing age, unhealthy diet, lack of exercise, smoking. So, she's put the smoking twice. Smoking. So, smoking, increasing age, and unhealthy diet and lack of exercise. And question 6 is, it says you are working in an acute ward. You received a call from the paramedic team to warn you of the arrival of a 73-year-old man who has had a fall with long lie. Which of the following symptoms is likely to occur? A. Hypothyroidism, pyrexia, hypothermia, myocardial infarction. Give it a minute. Right, let's review the answer. It says hypothermia. Hypothermia occurs when an individual's temperature reduces reduces below 35 degrees Celsius or 95 Fahrenheit. This usually occurs when individual becomes too cold due to long lie from a fall, having a wet clothes on, living in a cold environment. This could be characterized with shivering, pale, cold and dry skin, slurred speech, tiredness, confusion, and slow breathing. So, yeah, that makes sense. And this comes to the end of our review today, guys. You can put any comments and suggestions below and we will review it. Have a nice time and thank you for watching. Bye. Bye.